A diabetic drug, Ozempic, as the newest way to lose weight. The social media fad is causing a new concern, though, not just for those taking the drug, but for those who actually really need it. Dr. Carolyn Chang, a plastic surgeon here in San Francisco, is joining us this morning. Good morning. Thanks so much for joining us to talk about this.
Thanks for having me.
Absolutely. So I've been hearing about this all over the place. It seems to be the new fad that everyone's into. Celebrities and others believe Ozempic can help them lose weight. But what are the risks for that group, as well as the danger for the diabetics who actually need it?
Yeah, it's an interesting thing to talk about. I do want to say that Ozempic is FDA approved for diabetes, and so it is a safe drug. I think the problem that's occurred is that people, as a result of the side effects of Ozempic, can be weight loss, and as a result, it has caused a craze in the weight loss market. And so people who actually are not using it in the indicated way are taking it for weight loss. And in that sense, some of the side effects that can occur have not been as well studied in that group of patients that don't actually meet the criteria for Ozempic.
So, Dr.
Things
Chang,
can happen.
Yeah, so what are some of those side effects?
Yes, you can get pancreatitis in some rare cases. There's been a potential association with some cancers. Very well documented is a lot of GI symptoms, such as diarrhea, constipation, nausea, some other GI effects like gastritis. And also, I think what people don't know is that when you do stop the drug, you can actually rebound with weight even more than when you started.
Gotcha, and that's definitely not what you want. So because so many people are wanting to get their hands on Ozempic that aren't really necessarily needing it, how is this causing problems for pharmacies and supplies of the drug for the people who really do need it?
Well, at first when the craze started, there was a supply problem, quite severe, and the diabetics were not able to receive their drugs. I think as of now, the last I checked, the supply chain is loosening up, and so the hope is that the supply will be plentiful. I think we do want to remember also that there is a version of the same drug component in Ozempic that is approved for weight loss. And so for those patients that actually do meet the criteria, that is an acceptable drug to use, as well as at the lower doses for the diabetics.
Gotcha. So how effective is Ozempic for weight loss? I know a lot of people are just asking that.
So I first became aware of Ozempic in my office, actually. I had a longtime patient who came to see me after many years, and she was about 50 pounds down. And I asked her what she had done, and she told me about the Ozempic. It's quite effective. You can lose up to, I think the studies show, upwards about 15% of your body weight. What's remarkable in my practice is the number of people that are coming in with really great results when nothing else worked. They're coming to see me, unfortunately, though, because some of the side effects of weight loss is the loss of fat, and their faces are sagging and their bodies are sagging, and we're doing facelifts and body contouring for them.
Gotcha. So although it is a diabetic drug, is it still okay for other people to take it?
I think it is. It's an off-label usage for weight loss, but you really should be meeting the criteria, which is a BMI of over 30 or 27 if you have comorbidities like high blood pressure or cholesterol. But I do think that with the supervision of a physician, careful supervision, it is a safe drug. I think the danger becomes when people who don't meet the criteria are using it. We really do not have long-term data as to the effects of that, and that is a risk that you're taking, despite the hype.
So definitely
I think
talk to your doctor.
At the end of the day, yes.
Okay.
At the end of the day, it needs to be a careful decision made with a physician.
Gotcha. All right. A lot of really good information there. Dr. Carolyn Chang, thank you so much.